Hello, my name's Helen Brough. I'm a consultant in pediatric allergy and immunology, and as it's Allergy Awareness Week, I thought it would be useful to give you some information about hay fever. It is the peak of the tree pollen hay fever season, so I know a lot of you will be suffering from hay fever. So what I wanted to do in this video is talk to you about the background for hay fever, how we can test for hay fever, and some really practical tips on treatments that can help you manage your hay fever. So what is hay fever? Hay fever is essentially allergic inflammation of the eyes and nose. And people who get hay fever usually get this because of grass pollen allergy. About 25% of people can get it because of tree pollen allergy, and a fewer number of people get it because of weed pollen allergy. So hay fever is actually a misnomer. People used to think you got allergic to hay, and it's not the hay, it's the pollen particles that are released from, for example, grass or tree pollens. And generally you don't get a fever with hay fever. So inflammation of the eyes and nose is generally called allergic rhinoconjunctivitis, and you can get that not just to pollens, but you can also get that to house dust mite, cats, dogs and horses. So who gets hay fever? Generally, it's a combination of environmental factors and genetic factors. So if you have hay fever, probably somebody in your family has got some form of allergy. And then there are lots of environmental factors, obviously the pollens, the allergic components of those pollens, but there are other things like pollution that can make the pollens more allergenic. So in general, you start getting hay fever when you're a child, and this then progresses into adulthood. But some people can develop hay fever when they're adults. Classically, what you see is that people who move from the country to urban cities then start to develop hay fever. So in primary school, about 1 in 10 children will have hay fever. In secondary school, it's about 1 in 7, and adults can have hay fever in about 1 in 4 to 5 people. So hay fever is actually really common, and it can definitely cause issues with quality of life, and it can impact on school performance and also work performance. So when you get hay fever, the typical kind of symptoms you can get are itching or runny nose, itchy eyes. You can also feel very congested. You can feel like you have a headache, like you're a bit foggy, and all of these things can make you feel really under the weather. In fact, some people feel like they're developing a cold or developing flu with the early signs of hay fever, and this is especially important in the current COVID-19 outbreak. So generally, if you have hay fever and this goes untreated, it is possible that this can lead to sinusitis. This can give you headaches, pain in your face, facial areas here and here, and that can make you feel very unwell. So there are a few things that can look like hay fever that aren't hay fever. It's important to think about this. And for example, in children, a lot of infections can cause runny noses or red eyes, like conjunctivitis. And in adults, for example, you can have different things that cause swelling or congestion in the nose. For example, if you have vasomotor rhinitis, which is not allergic, this can just lead to having a runny nose and runny eyes when you walk out of the house into the cold. And for example, in pregnancy, you can get pregnancy rhinitis. So if you have hay fever between the months of about March to May, you probably have tree pollen allergy. If you have hay fever between the months of about May to August, you probably have got grass pollen allergy. Certain types of allergies, like house dust mite allergy, are generally there all year round but can be worse in the winter. And also if you have a pet allergy, you can have symptoms all year round if you're living at home with the pet that you're allergic to. So how can you test for what's causing your hay fever or your allergic rhinoconjunctivitis? So in general, there are 2 main ways that we test for this. The first is using skin prick testing, and this is a pain-free procedure where you take little drops of extract and you have a standard amount of different allergens in them. So for example, to Timothy grass or to birch pollen. And what you do is you put a drop of that extract on the forearm, and then you use a tiny lancet just to scratch the surface of the skin, and you wait for 15 minutes and see if it comes up with a little bump, which is called the wheal, and then the flare is the redness that goes around it. And that's something that's really useful to do in clinic because you can see the family, you can do the skin testing, and then you can tell people what they're allergic to, and you can give them advice on what they're allergic to and how to avoid it. The other way that we can do this is through using specific Ige testing, which is a blood test, and this looks for the allergic antibody in the blood, whereas skin prick testing looks for the allergic antibody that's bound to the skin cells on your forearm. So how can we treat hay fever or allergic rhinitis? So what's really important to say is that the treatments are essentially the same regardless as to what you're allergic to. They consist of allergen avoidance, symptomatic treatments, so standard treatments that you can buy over the counter but also can be prescribed, and then more specialist treatments like immunotherapy. So in terms of allergen avoidance, there are lots of things that you can do that can really reduce your symptoms of hay fever without the need for any medication. Some simple things to reduce exposure to pollens are to protect your eyes and nose from the pollens. So for example, you can wear wraparound sunglasses to protect your eyes, and you can put Vaseline just around the tips of your nostrils to prevent pollens from entering your nose. It's also important to reduce the amount of pollen that's on your body when you come home and your hair by having a shower before you go to sleep. And also not to dry your clothes outside during the pollen season, especially the bedding, because then you'll be sleeping on a bed of pollen. It's really useful to check the Met Office for pollen counts because then you can know whether there's a low, medium or high pollen count. And pollen is at its highest level at dusk. So what are the best treatments for hay fever? Essentially there are 4 types of treatments. The first one is if you have quite mild hay fever and you just need to have a bit of intermittent relief, you can take non-sedating antihistamines. These can be bought over the counter like cetirizine or loratadine. We don't recommend sedating antihistamines like Piriton because they can make you drowsy, which is very important in terms of driving or working or even school performance. There are other prescription antihistamines as well. Then the second type of treatment is nasal sprays. There's saline nasal sprays, which are really good to clear out all of the allergens from the nose, and then steroid nasal sprays, which are best used after the saline nasal spray because they're more effective. You can buy these over the counter as well, and there are also prescription nasal steroid sprays. It's really important to use the steroid spray in a certain way. It needs to be angled towards the side of the nose, not straight up, and you need to put your head forward and try not to sniff because otherwise you'll just swallow the medication. The last treatment is eye drops, and these can also be bought over the counter or can be prescription. And these are really important because what I see in my clinic is that the people who get hay fever really get very bad eye symptoms, and this is what causes the most discomfort to them. A couple of top tips about treatments for hay fever is that you should start the treatments a few weeks before the pollen season that you're allergic to. So for example, if you're allergic to tree pollens, you should start your treatments at the beginning of February. If you're allergic to grass pollens, you should start your treatments at the beginning of April. The way that you do this will mean that all of the receptors on your cells that are trying to find the pollens will get internalized into the cells so that when the pollen arrives, it can't actually bind to anything. So that's incredibly effective. So the standard treatments for hay fever are good and they can really help with your symptoms. However, when you stop taking the treatments, they stop working. There is another type of treatment called immunotherapy, which has the benefit of being the only disease-modifying treatment available for hay fever. The way that it works is that you use the allergen that the person is allergic to and you administer it either orally or through an injection. This changes the way the person's immune system responds to that allergen. It's usually a treatment course of 3 years, so it's usually reserved for people who have more severe symptoms. And you take that treatment and after approximately 1 year, you can start feeling the benefits. And usually there's a benefit of about 50% in symptom reduction and reducing the amount of medication you need to use. Some of the added benefits of immunotherapy are that after you stop the 3-year treatment, you still can expect to have some benefit over the next 3 to 5 years with reduction in your symptoms and the amount of medication you need to use. There have also been studies which have shown that immunotherapy can prevent the development of new allergies, and studies that have shown that it can prevent the development of asthma. So I hope that this video has been useful for you. There's lots more information available online. For example, Allergy UK has got some really useful information, leaflets for patients. I hope you all stay well and all stay safe.